Hello, today you'll be studying about routes of drug administration. So, route of drug administration basically means the path by which a drug will come in contact with our body and it will finally reach the site or desired action, okay, where it has to actually act. And the selection of route depends on various physical and chemical properties of the drug and also the situation, okay, based on which you'll be deciding the site of or administration route. So, and also it's based on physical property, rate and extent of absorption, and any effect of other gastric or juice like digestive juice or first pass metabolism. All these factors will affect the selection of route, and also condition, whether the patient is having any renal or liver problems, so that you have to maintain the accurate dose, okay. So in that condition, specific condition like CCF and all these, so you have to decide the appropriate route. And also condition whether the it is an emergency condition or routine condition. Emergency condition, we usually prefer IV or IM route because there the absorption rate and dose can be titrated. Routine, we usually give something which can be self-administrable and not dependent on someone like IM, where you will depend on some assistance. So those route of administration should be preferred. Moving on to various major routes of administration. So you have oral, that is enteral route. Oral means through mouth, and that will enter through the enteric system, that is intestine, and then get absorbed. Parenteral is something par. Par means away from the enteral system. So in that you have injections, which we'll be studying in detail. Various injections like IM, intramuscular, subcutaneous, all those you have. Inhalations, transdermal route and transmucosal route, okay. And then you have topical route for local application. In detail you'll be studying about all these in the further slides. So to begin with the first enteral system, that is oral route, here the drug is absorbed through the mouth or the enteric system into the blood circulation to reach the desired site of action, okay. So oral dosage forms include mainly the solid dosage forms, which include tablets, capsules or powders, okay. You would have seen many tablet or capsules. And liquid contains syrups for children, elixirs which and emulsions. So these things are oral dosage form in liquid form. And coming to the advantages of this oral dosage form, it is safe and convenient because you don't depend on, and it is easy to consume something through mouth, and it is an procedure where you don't need assistance, or and it is a non-invasive painless procedure. Taking a tablet by mouth will not harm you in any ways. And one important thing to be remembered is sterilization process is not required. That is, you don't have to maintain this drugs in an too much appropriate condition when compared to the injections and other route of administrations. Because of this, the tablets or this dosage forms are comparatively cheaper. So coming to the disadvantage of this route, the onset of action of the drug which is administered through the oral route is slow. Because of this reason you cannot give this drug through this, you cannot prefer this route for emergency condition, and in conditions where the patient cannot take the drug, and like nausea or vomiting, and in case of uncooperative unconscious patients in ICU, you cannot prefer this drug. And also drugs which cannot be palatable or also cannot be given through this route of administration. And absorption may be erratic because it depends if the patient is have few drugs have interactions with food, and also any malabsorption syndrome. All these will affect the absorption rate, and hence the absorption may be erratic, not possible. Some drugs will also be getting destroyed by the gastric juice, that is HCl, and they also undergo first pass metabolism in the liver before they reach the systemic circulation. So coming to the next major route of administration, that is parenteral. As I already told, par means beyond the enteral system, that is intestine, is what is called as parenteral route. And major advantage of this route is the absorption here is faster, okay, and this can also overcome the difficulties which we saw in the oral route, that is in nausea and vomiting. Also you can give this route, and these drugs will not provoke vomiting and nausea as we see with the oral route, and this can be preferred in unconscious and cooperative patient, and there is no interaction with food, digestive juice or liver in this route of administration. And coming to the disadvantages, the formulations are costlier because appropriate sterilization is required, okay, for these drugs. And since it is an invasive procedure, all those injection and all this, it is painful and they require assistance, and these procedures are risky because they will harm the neighboring tissues. Like when you give an intravenous injection, there is always a chance that you will harm an artery and nerve which is usually accompanying, so, and hematoma can occur. All these are few complications. Coming to the parenteral route, we have seen in the classification. So you have intradermal, subcutaneous, intramuscular, intravenous route. So these things are commonly used, that is why it is highlighted and you have to know. Intraperitoneal, intrathecal, intramedullary, intraarterial and intraarticular. These are the other parenteral route of administration. So this picture shows angulation and how the injections are administered, very commonly used injections. So this is the layer of the skin. So this is the epidermis. So this is the dermal layer, okay, and this is the subcutaneous layer of the skin, and this is the deep muscular layer, okay. So this is how you give an IV injection. So intravenous, as the name suggests, you have to administer the drug through veins, right? So in the skin, all the three layers, that is dermis, epidermis and subcutaneous, are less vascular, and the vessels are mainly present in the muscles, okay. So the angulation here is 15 to 30 degree and you have to inject into the vein. And then coming to the commonly used subcutaneous route, so as the name suggests, it is into the subcutaneous layer of the skin, so which is here. This is the subcutaneous layer of the skin, and the angulation is 45 degrees. Usually we will pinch the skin with the left hand, and with the right hand the injection is given at 45 degree angle. And then moving on to the intramuscular injection, that is direct. You have to just prick 90 degrees to reach the deep muscular layer of the skin, 90 degrees. So this is the angulation, subcutaneous 45, intramuscular 90. These two are very important. So we will see the individual route in detail. So to begin with the intradermal route, so this is how you give an intradermal injection. So as the name suggests, it is into the dermal layer of the skin, it is just beneath the skin, so very little you have to just inject the needle. So this is most commonly preferred to give vaccines, okay, and also to test any allergens, any allergic test, like in case of asthma and patient with allergy, to do patch test, where different allergens are injected with very little dose, so that the you can find out the allergen and you can tell the patient to avoid such drugs or food things, so that they can prevent allergy. So this is mainly given for this route is mainly preferred for vaccination, because very little dose can be administered and it will produce a good immunogenic response. Disadvantage of this route is that self-administration is not possible, okay. It is painful as it is an injection. Absorption is very slower, and you cannot administer large dose of drug. And drugs which are given through this route is to do diagnostic purpose and preventive. Preventive is through vaccination, that is BCG vaccine is the one which is given through this route. a diagnosis to you can do tuberculin or Montu test, which is used for diagnosis of TB. Okay, and also any allergic test, that is the patch test, which is used for in allergic conditions. And the next one is the subcutaneous route. So as the name suggests, the drug is deposited in the loose subcutaneous layer of the skin, and since it is less vascular area, absorption is slower than IM, and self injection is possible. Okay, this is one thing which is very important. This type of injection can be administered by themselves. So, and most commonly given injection through this route is insulin. Okay, so very important to be remembered. And disadvantage of this route is you can only give a small amount of drug. Okay, small amount of drug can be given, and irritation can occur when you administer the drug. Irritant drugs cannot be given through this route, because it can cause sloughing and necrosis of that particular area where you have injected. And there are few newer advances in subcutaneous route, that is Dermojet. Okay, Dermojet is a newer type of subcutaneous newer advant in the route of administration, where the drugs are delivered at a high velocity through the dermal layer of the skin using a gun. Okay, advantage of this is it is painless, and this is suitable to give vaccines. Similarly, we have something called as pellet implantation. So here the drugs are packed in the form of a pellet, and it is deposited in the subcutaneous layer of the skin. What is the advantages? And this can be left for few weeks or months, so that a constant plasma concentration of the drug can be provided. From that pellet, the drugs will be slowly released, and it will help to maintain the plasma concentration. Examples of drugs which are given through this route is deoxycatecholamines, which is a catecholamine precursor used in case of Cushing syndrome. These are lifelong treating conditions. And testosterone, this can also be given through pellet implantation. Celistic implantation is similar to pellet implantation, but the dosage form here, or the drug is packed in a celistic tube. Okay, and this is also implanted similarly, similar to pellet implantation in case of subcutaneous tissue. Here also the drugs will be released over a month to produce constant plasma concentration. Examples of drugs which are administered through this route is hormones and contraceptives. Okay, one thing to be remembered here is after the desired action is over, the non-biodegradable substance, that is the celistic button, it should be removed by using through a procedure. So that should be remembered. It is a non-biodegradable implant, and it should be removed after the desired duration of action. So moving on to the next, that is intramuscular injections. So intramuscular, as the name suggests, it is into the muscle. Large skeletal muscles are usually chosen, okay, for this injections. Most common site is upper outer quadrant of gluteus maximus, as we all know. So gluteus maximus is the most common preferred site. In the hands, it is into the insertion of deltoid and triceps. These are the common muscles which are used. In infants, we have one more muscle, that is the anterior lateral aspect of the thigh. So in the middle third region, we will usually give IM injection, mostly vaccines. So DPT vaccine is the one which is most commonly given through anterior lateral aspect of thigh. Advantage of IM injection is that the absorption is rapid, okay, when compared to oral or subcutaneous injection. And because rapid absorption, onset of action is also very quick. Mild irritant, oily preparation, colloids, soluble substances, suspensions, all these can be administered through this route. That is why oily preparations can cause little pain. Other things can also be administered through this route. That is the advantage of this route. And disadvantage is the volume in this route is limited. For example, the maximum volume you can inject at one time is one time at one site. Okay, like in one gluteus muscle, if you are giving one injection, 2.5 ml is the maximum dose you can give. On likewise on the other gluteus you can give 2.5 ml. So this is the maximum dose for gluteus maximus. And it can also cause irritation, abscess formation if not administered properly, and tissue damage, like when you inject you can injure the nerve or even artery. That is why always when you inject an injection, once you prick, it is always advisable to pull back the plunger so that you are not into artery. So all those precautionary measures should be taken. And IM injections are painful. So these are the disadvantages of IM injections. So moving on to the intravenous injection, as the name suggests, it is injected here into the veins. So the injections can be given as a bolus injection in few seconds, or it can be an infusion over minutes to hours. Okay, this is the fluid, how it is connected, and this is infusion, okay, given for long time. And bolus injection, just you have to just inject and given bolus injection. So advantage of intravenous route is, it is very important. The bioavailability with intravenous route is 100%. Okay, very important. It is the one which is having highest bioavailability. So you can use it for emergency condition. Okay, and irritant drugs which cannot be given through other route can also be administered through this route, but you have to make sure that there is no other complications like thrombophlebitis. And you can also give large volume of drugs through infusion, and since the bioavailability is 100%, you can also titrate the dose. How much you have given, all that can be titrated in emergency condition. Disadvantage of this route is that you have to maintain strict aseptic precautions, otherwise it can lead to infections. Okay, so aseptic precaution is required. This is the reason this route of administration is costlier, and it is very painful and risky procedure, because there might be chances that you will damage any arteries or veins. So that is why you have to have good precautions. And there can be complications like thromboembolism with inappropriate intravenous technique when you are just pushing air. Okay, so all these are the precautions which you have to be taken. Thromboembolism can occur, thrombophlebitis, all these are complications. So few minor routes which you have to just remember is that intraperitoneal, the drug here is given into the peritoneal space. Okay, why we choose this route is because it has larger surface area, so it will help in rapid absorption of drug. Okay, here also you have to maintain aseptic precaution, and it is a painful procedure. Risk is that there can be adhesion and infections in the peritoneal cavity, which can even spread to the abdominal organs like colon. So you have to take major precautions. It is not commonly used, and it was previously used to give anti-rabies vaccine. Now it is mainly preferred for dialysis. Okay, peritoneal dialysis in case of poison or renal failure, those patients it is preferred. Or in case of ascitic fluid tapping, there also we prefer peritoneal route. So moving on to the intrathecal, where the injection is given in the spine, that is through spine into the subarachnoid space. Okay, most commonly given injection through intrathecal is the spinal anesthesia. Okay, anesthesia is only where we do. And also in case of diagnostic tapping, in case of meningitis also we do intrathecal procedure, where we will remove some amount of CSF fluid for analysis. And so here the injection is through subarachnoid space. Okay, and the advantage of this route is you can directly inject some drugs like antibiotics, or diagnostically, as I told, you can take the CSF fluid in case of meningitis, or with any problems with CNS can be treated through this route. Disadvantage is strict aseptic precautions and expertization. Until then you cannot do the procedure, and because a normal person or with one or two attempts, you will not develop appropriate technical methods, so it will need proper assistance because there is nerves and all that, so you cannot injure all those nerves. It is also a painful and risky procedure, so you have to take strict precautions. So examples is radio opaque contrast media, which is used in case of myelograph in case of any spinal diseases, and spinal anesthesia. As I told, bupivacaine is injected through intrathecal route to produce spinal anesthesia. Next, moving on to intramedullary, means into the medullary space of bone. Okay, most common bone which is preferred is tibia or sternal bone. Okay, this is most commonly preferred bone. Why we choose this is mainly for bone marrow transplant. This is where we usually use this. Okay, bone marrow transplant. The reason being, it is this route will produce fast onset of action, since major vascular spaces of bone will directly end up in or directly communicate with large bones, so it will produce faster action. The procedure is actually risky, painful, and you also need a strict aseptic precautions. So these are few disadvantages with case of medullary administration. So in this picture you can see, so this is skin layers, muscle, and then bone. This is the medullary cavity. So this area, medullary cavity, and the injection is mainly here given through the medullary space. So moving on, intra-arterial. So as the name suggests, it is into the desired artery. Okay. So advantage or positive point is that it will produce greater concentration at the desired site, and this also requires good experience and aseptic precautions, very important. There is no diagnostic, this is mainly used for diagnostic purpose, mainly angiography, all coronary or cerebral, all those angiographies is where we mainly prefer, like this, to see any clots or any conditions, any diseases, so we usually prefer. One condition where this is used for therapy is in case of malignancy, nitrogen mustard, it is used for malignancy of limbs. Moving on to intra-articular, as the name suggests, it is into the articular surface of the joint space. Okay, so there is what you inject the drug. It is mainly to produce the symptomatic relief at the desired site. Example is injecting hydrocortisone or gold in case of rheumatoid arthritis. Okay, this is one of the conditions, and advantage of this route is localized action is improved, and this condition also, this procedure or also requires strict aseptic precautions, that is important, and you can even damage joints, that is why you have to take precautions, and this is also a painful procedure. With that, we have finished the parenteral route. Moving on to the next, that is inhalational route of administration. So inhalation is something where it is where you will administer the drugs through nose or mouth through inhalation, that is through breathing. Advantage of this route is the drugs are absorbed faster and quicker, because once the drug enters into the mouth and through nose into the respiratory tract, there is large respiratory area where there is large surface area where the drug can be easily absorbed into the systemic circulation, and this can be administered by themselves. Like if a patient is having asthma and dyspnea, he can just put in his mask and start breathing with oxygen. So it is self-administered. One major disadvantage is this procedure can cause irritation in the mouth or in bronchial tree or bronchus. So in the bronchial, if there is irritation in the bronchus, it can increase the bronchial secretion and cause cough. Similarly, in case of mouth, it can increase the salivation, and the drug particles can also deposit in various areas of mouth. Examples are oxygen and general anesthesia inhalation. This is through mouth. Meter dose inhaler can be used in case of, that is salbutamol, used in case of asthma. Spin inhalers with sodium chromoglycate in case of children. So all these are few examples of inhalational route of administration. So moving on to the transdermal route. So in this procedure, the drug is delivered through the dermal layer of the skin, and transdermal patch mainly contains the drugs in a patch like substance, which you will see in the later slides, and it is the patch is put on the desired area so that to produce faster site specific action. So advantage of this route is that there will be sustained release of drugs over several hours or days. Okay, transdermal patch. Disadvantages: the patch can cause irritation after some time of application. So few examples we have, that is scopolamine, which is used for motion sickness. This is a scopolamine patch, and this is a nitroglycerin patch which is used in case of angina, NTG. So this is also an important diagram which is showing different layers of transdermal delivery system. So see, this is the backing film, first one. This yellow is the drug reservoir. From this drug reservoir, the drug is released through a drug releasing membrane, okay, through which it will enter into the dermal layer of the skin. So this is a contact adhesive layer, and this is the dermal layer. Drugs will enter into the skin. So this is very important, different layers. There are few different routes of transdermal. Inunction means the drug here is applied on the skin by rubbing. Okay, inunction, that is rubbing for systemic absorption. Ionotophoresis, a galvanic current is used here to improve the penetration of the skin through the skin. Example for this is fluoride ionotophoresis, which is used in case of dental hypersensitivity. Okay, this is important. And jet injections, like you saw dermojet. So a forced jet is used to deliver the drug into the dermal layer through a gun-like substance. So the next one is transmural route. So as the name suggests, here the drug is delivered through the mucous membrane of the skin, or nasal cavity, rectum, or through sublingual. All these are mucous membrane. So through this layer, so the drug will be delivered. The first one is the nasal through inhaling through the nose like this. Through the nasal cavity, the drug will be absorbed. Advantage of this route is there is no problem of destruction of the drug through the gastric juice, or it also bypasses the liver. There is no first pass metabolism in the liver. Examples are, apart from antihistamine group of drugs which is used for local action in the nose, few hormones, that is gonadotropin releasing hormone agonists and desmopressin, which is a vasopressin analog. Okay, so these two can also be given through the nasal route. This is very important, and example, these two are important. Moving on to the sublingual route. very important, most commonly asked for 3 markers and also in MCQs also. Here the drug is placed just below the tongue like this, okay, because this has high vascular supply, okay. So here the drug is just placed beneath the tongue, or the tablet can also be crushed and just kept beneath the tongue for systemic absorption. What is the advantage of this route is it will also produce rapid absorption, okay, and the action can be terminated when the desired action is produced by spitting out the tablet. It will also bypass the liver. And only disadvantage and one thing to be remembered in this is only lipid soluble and non-irritant drugs can be administered through this routes. Those drugs which are not lipid soluble cannot be administered through this route. Okay, so this is one important thing to be remembered. Examples are nitroglycerin, very commonly given and used, nitroglycerin. So nitroglycerin has high first pass metabolism, and that is the reason we prefer this route. And also bupropion, nifedipine, these are other drugs which are given through this route. So the next thing is rectal route of administration. As the name suggests, it is into the rectum. The tablet is, or the suppository is usually kept in the rectum. Usually the suppository shape will be like this, like a bullet. Okay, these are few suppositories. So the advantage of this route is this route can be preferred in vomiting and unconscious patients, and this is the preferred route of administration in case of febrile convulsions in children. Disadvantages, as it is a rectal route, so drugs which will cause rectal irritation should be avoided. It is an inconvenient and embarrassing procedure, and the absorption cannot be predicted. 50% of drug is bypassed by liver, and examples are suppositories. These are the suppositories. Retention enema, which we do in case of all the patients who are undergoing surgeries to evacuate the colon. And paracetamol suppository, I said, this is used in case of febrile convulsions in kids, and bisacodyl in case of severe constipation. So various topical route of administration. So usually here the drugs are administered over the skin for local application, also on the mucosal surface like nose, ears, okay, anal canal, vagina. Something which is kept in the vagina is called as pessary or dog, okay. So something which is through the vagina, pessary. Something which is used topically in the urethral through urethra is called as urethral bogey, okay. Through the rectum it is suppositories. Please remember this name. So it is usually asked as an MCQ. And the dosage form here would be a lotion, lozenges through in the throat, ointment or cream, okay. Eyes, you would have seen eyes ointment. No, even in the nose you have an ointment, ear you have an ointment, creams both you have, and even through into the vagina, all this we'll be using ointment, gels, and nasal spray, tablets. All these are various dosage forms. Few slides I have also mentioned few newer drug delivery systems. The important thing is for important thing why they have developed newer type of drug delivery system is to improve drug targeting to the specific site and to prevent its absorption at other sites, providing side effects, right. So this will improve drug delivery to the specific site and reduce the side effects and improve the patient compliance, and also prolong the duration of action at the desired site. So there are few examples. Examples are mentioned in detail in further slides. So first thing is oxycytes. Oxycytes are substances which are kept in the eye, okay. They will be like this, like a thin elastic button, okay, and this has been kept like this for slow and sustained release of drug, and the process is through diffusion. Okay, so this is a pilocarpine octacert which is used in glaucoma. This is also one of the specific drug delivery system. And the next one is progestastat, which is an intrauterine contraceptive device used to prevent conception, and this will work for 1 year. Okay, and that is, it will deliver progesterone constantly at a specific rate for a period of 1 year. Next one or next concept is prodrugs. Prodrugs are those substances, they are inactive substance or inactive form of drug which will get metabolized in the body to become active. Okay, so they are inactive forms of drug which will become activated in the body through metabolism or through biotransformation. Okay, very important. This question is usually asked as a 3 marker and also in MCQs, very important. What is the importance of prodrug? Since it is an inactive form, its bioavailability will decrease once it is getting converted in as an active form in the body. How it is? By preventing its degradation through the process of absorption. So they will increase the bioavailability, through which it will prolong the duration of action, and they will also improve the tolerability by decreasing the side effects, and they also improve drug targeting to the specific site, and they provide appropriate stability to the drug. Okay, that is, they will not be destroyed by any gastric juice or any other substances through the process of absorption. Examples are levodopa, which is a dopamine precursor used in Parkinsonism. So levodopa is resistant to the decarboxylase enzyme, which was destroying dopamine in the peripheral area, and it is can easily pass through the blood-brain barrier and provide appropriate concentration in the basal ganglion to treat Parkinson's. Likewise, we have esters of penicillin, that is procaine, penicillin G and all that, antibiotic penicillin, and this is dipivefrin, which is an adrenaline prodrug which is used in case of glaucoma. You have many other examples of prodrug. So moving on to the computerized miniature pumps. Okay, this is a newer devices which will deliver the drug as programmed. It can deliver the drug continuously or intermittently based on need basis. So examples for such things is insulin pumps, which will deliver insulin because they will be having a glucose sensor which will sense the body glucose levels, and then if there is decrease in the increase in the glucose levels, they will trigger the release of insulin, and then gonadotropin releasing hormones for contraceptive purpose. So you have computer miniature pumps. The next newer drug delivery system is the monoclonal antibodies. So these antibodies are obtained from hybridoma technology, okay, from single or multiple clones of cells. Okay, so trastuzumab is an monoclonal antibody which will bind to human epithelial growth factor 2 protein receptor, and this is mainly used for breast cancer. They will prevent proliferation, improve the regression of cancerous cell, and prevent metastasis. Rituximab is a monoclonal antibody which is against CD20, and this is used in case of lymphoma. The last newer drug delivery system is liposomes. Liposomes are an artificially prepared vesicles which will contain drug. Okay, so these liposomes can not only act as a vehicle to deliver drug, but drugs and nutrition, but also they act as an appropriate delivery system and help in site specific delivery. Okay, that is important, site specific delivery, because they are made up of lipid bilayer. Okay, lipid bilayer they are made up of. So this will diffuse this will diffuse through the cell membrane and thus help delivering the contents which is present in the liposomes to the appropriate site. Few examples of liposomal drug delivery is amphotericin B. It is also available as a lipophilized form. Cytarabine, anti-cancerous drug, daunorubicin and morphine. These are few examples of drugs which are delivered through the liposomes. With this we are ending the various routes. You have few MCQs here. So the first MCQs is the true statement about route of drug administration. So IV will provide 80% bioavailability. IM administration do not need sterilization technique. IV injection provides local tissue necrosis and irritation. Inhalation produce delayed systemic bioavailability. So all the statements are wrong. IV bioavailability is 100%. IM will need sterilization. IV can produce local tissue necrosis and irritation. Inhalation will improve systemic absorption in per se. So the answer here is C. The next question is, the following are given intradermal. All are given. Test dose is given. BCG is given. Montac. Insulin, it is subcutaneous route. And which of the following is true? This is about order of kinetics. Here the answer is C. IV will follow first order kinetics. And the next question is about which of the following drugs are given IV route. Okay. So for these things you should also have knowledge of. It will help once you go on reading. So you'll this various drugs and routes you'll understand. Heparin is given IV, pantoprazole IV, ranitidine also IV. Sumatriptan is usually tablet form, neomycin cream. Okay, so ABC is the answer. Thank you.